Welcome to the Deep Dive. Today we're tackling a topic that, let's be real, makes a lot of people squirm a bit. Root canal treatment. You hear the term and maybe you immediately think, ouch.
Yeah, it definitely has a reputation, doesn't it? Often kind of misunderstood.
Exactly. So our mission today is to, demystify. We want to get into why it's needed, what actually happens, especially across those 3 visits we hear about.
Right. The aim is really to reduce some of that anxiety by providing clarity.
So let's just dive right in. What is a root canal, fundamentally, beyond the scary name?
Okay, so at its core, it's a procedure designed to save a tooth that's badly decayed or infected.
Save it. Right, not just yank it out.
Precisely. The main action is removing the damaged part inside, the pulp. That's the soft stuff, nerves and blood vessels. Then it's all about cleaning, disinfecting really well inside those little canals in the root.
Ah, the canals within the root. So that's where the name comes from.
Exactly. Cleaning the root canals. Then they fill it and seal it up to stop future trouble.
Okay, so you're basically cleaning house inside the tooth root.
That's a good way to put it. And saving that natural tooth. That's really key.
Why is that so important, keeping the original tooth?
Well, think about it. Your teeth all work together, right? For chewing, biting. Keeping your natural tooth helps maintain that balance, stops other teeth from shifting around. It even helps preserve the jawbone structure. It's all connected.
I hadn't really thought about the jawbone part. Okay, so that's the what. Why does a tooth get to the point where it needs this kind of intervention? What goes wrong inside?
Good question. It happens when that pulp tissue inside gets inflamed or, worse, infected. A really common cause is deep decay, a cavity that just kept going until bacteria got way inside.
Okay, decay. What else?
Sometimes it's from having lots of dental work done on the same tooth over time that can irritate the pulp, or even just a crack or a chip. It seems small, maybe, but it can be like an open door for bacteria.
Right, a tiny crack letting bad stuff in. And what if you just, ignore it, hope it goes away? Can't your body just fight it off?
Not really, unfortunately. Inside the tooth, it's a confined space. Your immune system can't easily get in there to clear the infection effectively. So if you leave it, the infection usually gets worse. That leads to, well, often severe pain.
Yeah, tooth pain is no joke.
And it can lead to an abscess that's like a pocket of pus forming at the root tip. Really not something you want to ignore.
Okay, definitely not ignorable. An abscess sounds awful. So the solution is the root canal procedure. And you mentioned it often takes 3 visits. Why spread it out like that?
Yeah, the multi-visit approach is really about being thorough, ensuring everything is meticulously cleaned and disinfected. Each visit has a specific focus, which maximizes the chances it'll work long-term and minimizes the risk of reinfection later.
Okay, thoroughness. Let's walk through visit number 1. You go in, maybe feeling a bit nervous.
Yeah.
What happens first?
So, first things first, anesthesia. They'll numb the area completely, just like getting a filling. You shouldn't feel pain during the procedure itself.
Okay, numbing is key. Then what?
Then the dentist makes a small opening, usually in the top, the crown of the tooth. Think of it like creating a little doorway to get inside where the problem is, into the pulp chamber and those root canals.
Got it. Access achieved.
Oh,
What's the main job during this first visit once they're inside?
the absolute crucial part of visit 1 is finding and cleaning out every single root canal. They use these tiny specialized instruments to carefully remove all the infected pulp tissue, bacteria, any debris. Just get it all out.
Sounds delicate.
It is. And this cleaning step is vital. It stops the infection spreading and starts relieving that pain you might have been feeling.
Now, the source text mentions biomechanical preparation,
Yeah.
BMP. Sounds pretty technical. What's that about?
BMP. Yeah, it sounds complex, but it's basically shaping and cleaning the canals. Think of it like preparing the walls. They use a series of files, each one slightly larger than the last, flexible ones.
Files, like tiny little pipe cleaners or something.
Sort of, but much more specialized. They carefully clean the walls and also shape the canal, widening it slightly, smoothing it out. This helps remove everything and creates a good shape for the filling later.
So it's cleaning and shaping.
Exactly. And during this, they're also flushing the canals with an antimicrobial solution, like rinsing it out to kill any remaining bacteria.
Okay, that makes sense. Getting it really clean.
Super clean. This whole BMP process is critical. No hiding spots for bacteria left. It really sets the stage for success. Then, usually, they place a temporary filling to seal the opening until the next visit, like a protective cap.
Right, temporary seal. So visit 1 is access, clean, shape, disinfect, temporary fill. What happens when you come back for visit 2? More cleaning.
Often, yes, more cleaning and checking. They take out the temporary filling and take another really good look inside the canals. The goal is just absolute certainty. Make sure any tiny bit of remaining debris or bacteria is gone. Meticulous is the word.
Still focusing on getting it perfectly clean.
Absolutely. Sometimes, if the infection was really bad, they might even put some medication inside the canals at this stage.
Oh, okay. Like an extra disinfecting step.
Yeah, exactly. Before putting in another temporary filling, potentially.
And the shaping. Does that continue in visit 2?
It can, yeah. Maybe some further refining, more smoothing with those files, just ensuring that optimal shape for the final filling, making sure it's ready for that tight seal later on.
Gotcha. So second visit is often re-clean, re-examine, maybe more shaping, maybe medication, another temporary fill.
Okay.
And get ready for visit 3, the grand finale, right? This is the permanent fix.
That's the one. Visit 3 is about sealing it all up for good. First, temporary filling comes out. They double-check everything is totally clean and, importantly, dry inside the canals.
Dryness matters.
Oh, definitely. You need it dry for the filling material to work properly and seal effectively. Then comes the filling part.
And this is where gutta percha. I think I've heard that weird word.
Haha. Yeah, gutta percha. It sounds strange, but it's a rubber-like material, very biocompatible. It's the standard for filling those clean canals. It's usually used with a sealer paste. Think of it like packing those tiny tunnels completely full so nothing can get back in.
Packing and sealing. Makes sense.
Once the canals are filled, then comes the final restoration on the outside of the tooth. This is usually a permanent filling, or quite often, a crown.
A crown, like a cap covering the whole tooth.
Exactly. The crown protects the tooth, gives it strength back, restores its shape so you can chew properly, and helps prevent it from fracturing down the line. It's like a protective helmet for the treated tooth.
Okay, that whole process, while detailed, sounds very methodical. So after all that, what are the big pluses? Why go through it?
The benefits are huge, really. First, pain relief. That awful pain from the infected pulp. Gone, because the source is gone.
That alone sounds worth it.
Definitely. Second, you keep your own tooth. We talked about why that's good chewing, alignment, bone health. It's always better than losing the tooth if you can save it.
Right, keeping the natural structure.
And third, aesthetics and function. Once it's restored with a filling or crown, it looks and works like a normal tooth. You can smile confidently, eat normally. I actually had a friend, they were in agony before their root canal, just miserable. The relief afterwards was, well, immediate and immense for them, really highlights that pain relief point.
Yeah, that's a powerful example. Okay, so it sounds effective, but there's this cloud, this fear around root canals. What are the big myths or misconceptions people have?
Oh, absolutely. That fear factor is real, but often based on outdated ideas. The number one myth, that root canals are incredibly painful.
That's the big one, yeah.
But with modern anesthetics, like we said, it's generally no more uncomfortable than getting a regular filling. Seriously, most people report little to no pain during the actual procedure.
Okay, so the pain thing is largely a myth now. What else?
Another one is that they don't work well, or they have low success rates, or even weirder myths, like they can make you sick systemically.
Oh, I think I've heard something like that online somewhere.
Yeah, that's not backed by good science at all. Root canals are actually a very predictable treatment with a high success rate when done properly.
Let's just focus on that pain aspect again because it's such a big hurdle for people. Realistically, is it painful?
Realistically, no, not usually during the procedure itself, thanks to the anesthetic. Afterwards, you might have some tenderness or sensitivity for a few days. That's normal.
Like after any dental work, maybe?
Pretty much, yeah. But it's typically manageable with over-the-counter pain relievers. You know, ibuprofen, acetaminophen, your dentist will advise on that. It's generally not severe pain.
Okay, manageable discomfort, not agony. What about the success rate? You said it's high.
Very high, yeah. Often quoted as being over 90% successful.
Wow, that's pretty good odds.
It really is. And look, if you get the tooth properly restored afterwards, usually with that crown, and you take good care of it.
Meaning brushing, flossing.
Exactly. Good home care, plus regular dental checkups. That treated tooth can genuinely last a lifetime.
So longevity really depends on follow-up care and good habits.
Absolutely. It's a team effort between you and your dental team.
Which brings us to prevention. How can people try to avoid needing a root canal in the first place? What are the best bets?
Prevention is key. Number one, excellent oral hygiene. That means brushing thoroughly twice a day with fluoride toothpaste, Flossing daily, getting between the teeth where brushes miss.
Flossing is crucial, isn't it?
That's so crucial. And maybe using an antibacterial mouthwash, just reducing the overall bacteria load.
Okay, hygiene first. What else?
Regular dental checkups. Cannot stress this enough. Your dentist can spot decay or other problems early when they're much easier and less invasive to treat, way before they get bad enough to need a root canal.
Catching things early.
Yeah.
Makes sense.
Also, protect your teeth. If you play sports, wear a mouth guard. Avoid chewing on really hard things like ice, popcorn kernels, hard candy, things that can crack a tooth.
Right. Avoid the tooth breakers.
And finally, diet plays a role. Less sugary stuff, less acidic drinks, more fruits, veggies, whole grains, good for your teeth, good for your whole body.
All sounds like solid common sense advice for overall health, really. Okay, let's say someone has just had the procedure done. What should they expect right afterwards, the first few hours or days?
Okay. Immediately after, as the numbness wears off, you might feel some mild sensitivity or tenderness in that area. Like we said, over-the-counter pain meds usually handle it fine. Your dentist will likely tell you to avoid chewing directly on that tooth for a few days. Give it time to settle down.
Let it rest.
Exactly. And just follow whatever specific instructions your dentist gives you. They know your specific situation.
And looking longer term, does a root canal tooth need special treatment forever?
Not really special treatment, but consistent care, definitely. Keep up those regular dental visits for checkups and cleanings, and maintain that great home care brushing and flossing. A tooth with a root canal can still get decay around the filling or crown or develop gum problems, just like any other tooth.
So it still needs the same TLC as all the others.
Precisely.
Yeah.
And make sure you go to any follow-up appointments your dentist recommends. They'll want to check that everything healed well and that the crown or filling is doing its job protecting the tooth.
Okay, so wrapping this all up, it really sounds like the takeaway message is root canal treatment, despite the scary reputation, is actually a standard, very successful procedure.
Yeah, it's designed to stop pain and save your tooth.